Hope your week is off to a good start. You're watching Arirang TV's special coverage of COVID-19. I'm Min Sun-hee. It's been about 3 months since we've been covering the pandemic, and some countries are now reporting a significant drop in cases, while others are tackling 1 million and even 2 million infections. We begin the program now with the headlines for this Monday with our Kwon Soon-man and Noaram. Welcome.
Hi, Sunny.
So we had some alarming numbers over the weekend. How are we starting the new work week?
Well, the new work week starts off much better than the figures we saw over the weekend. In fact, we had 17 new cases today if we take a look at our numbers, with 11 local infections and 6 imported cases. And that is actually the lowest single-day rise in a month that we have this Monday. And the death toll remains at 280, while 1,277 people are still quarantined and 10,881 people have fully recovered. Now, compared to last Monday when we had 37 cases, we are down by 20 this Monday. But in between, there were some concerning numbers, especially over the weekend, where we even rose to 67 cases. Now, although the plunge to below 20s does seem to give a relief, the government in its early Monday briefing noted that this can be attributed to the lower number of COVID-19 tests that were conducted on suspected patients over the weekend. Also, officials noted that new cases were scattered in various parts of the country. Apart from the Seoul metropolitan region, there were new infections in Chungcheongnam-do province, as well as a number of southern cities. Meanwhile, with Korea experiencing the first heat waves of the summer season, health authorities discussed ways to reduce the burden of the medical staff by further adjusting working hours as well as the environment, such as at outdoor screening centers.
Meanwhile, Seoul's Mayor Kwak Soon-man had some grave words to share with the public here.
Yes, he said he had an important announcement to make, mentioning the number of new sporadic cases in the greater Seoul area has been growing. The number of elderly patients has been increasing tenfold in the past 2 weeks, and unidentified cases account for over 10% of cases in that span. The mayor said Seoul City may have to return to stricter social distancing measures, saying that will happen when the number of new cases stands at over 30 for 3 straight days beginning today. Mayor Kwak Soon-man expressed also concerns of a second wave in the country that could come within a month, citing experts' analyses.
Right, so what is the latest on the global front then?
Well, there is no slowdown in sight when we take a look at the global figures. In fact, we now have more than 9 million cases if we take a look at our graph now, and with more than 100,000 daily new cases that we've been seeing over the past weeks. And if we take a closer look at the regions, the US and Brazil account for some 3.4 million cases combined, more than 2.3 million in the US, and Brazil also surpassed that 1 million mark. We will going to talk about that later again. And moving over to other regions, concerns in countries like Peru and Chile, which now have over 254,000 and 242,000 infections respectively. And Germany has over 191,000 and Turkey 187,000.
Now, as you mentioned, so Brazil has seen its total number of cases surpass 1 million. Tell us a bit more about the case there, and also the fact that travel bans have been lifted in the UAE.
Right. Well, first off, Brazil hit that milestone on Friday local time. It recorded a new daily high of 54,771 new infections on that day, which raised the total past the 1 million mark. The country's first COVID-19 case was confirmed on February 26th, and roughly a month later, it had 3,000 and more than 15,000 by early April. Now, recently, Brazil's cases have been increasing by 30,000 a day, with some 1,200 fatalities on a daily basis. Nevertheless, major cities, including Sao Paulo, have started to reopen the economy, with the country's president, Jair Bolsonaro, continuing to downplay the risks of the virus. Many experts warn Brazil's cases could surpass that of the U.S. in the coming months. And in the United Arab Emirates, business hub Dubai is planning to lift travel restrictions on tourists beginning July 7th. 30th for the first time since the city went into a lockdown for around a month. Tourists will need to present a certificate proving they tested negative for the coronavirus or undergo screening at Dubai airports. Residents stranded abroad will begin to return from this Monday, and outbound travel is to be allowed starting Tuesday. The UAE has been experiencing a slowdown in recent weeks. It has now a total of around 45,000 cases with 302 reported fatalities.
All right, so thank you for that. Stay with us for more on the domestic updates after the briefing.
All right.
Aram, despite hopes for a drop in global numbers, I understand we've seen a record daily increase.
That's right. Things certainly aren't really looking good. The WHO has reported that over 183,000 new cases of the coronavirus was reported over the past 24 hours. Now, this marks the largest single-day increase since the pandemic began, and there were also more than 4,700 deaths as well. Nearly half of these cases came from either the US or Brazil, as cases are spiking in both countries, as we saw in the numbers earlier. Over two-thirds of the new deaths were also reported in the Americas as well. Cases are also on the rise in southern Asia and the Middle East as well. And the WHO warned last week that the world was entering what it called a new and dangerous phase as stay-at-home orders are being lifted. And the WHO chief had also warned that the pandemic is accelerating as well.
Now, given that scenario, Korea is imposing some entry restrictions on high-risk nations.
That's right. The South Korean government will temporarily restrict visa programs and flights from Pakistan and Bangladesh. Exceptions will be in place, however, for important business trips or visits by government officials, such as diplomats. The government will also put a temporary ban on non-scheduled flights from those countries. And the move comes after the majority of new imported cases in Korea came from Pakistan and Bangladesh. And authorities will also check if foreigners with non-professional employment visas, known as E9 here in Korea, have places to stay for 2 weeks, self-quarantine in Korea before they arrive. And if they don't, I'm afraid they won't be allowed to enter the country.
I see. Meanwhile, an official recommendation for a COVID-19 treatment has been made.
That's right. Korean health authorities have now officially recommended the use of the antiviral drug remdesivir for coronavirus treatment. We've been hearing a lot about this drug. It is best known as a treatment for Ebola. Now, the advice did come after clinical trials. The use of remdesivir is being advised for severely ill patients, however, who require oxygen therapy for 5 days. However, hospitals can extend this treatment period up to 10 days, depending on the situation. The Central Clinical Commission, which is a government-organised task force, however, decided not to recommend the use of chloroquine or hydroxychloroquine. These anti-malarial drugs had been touted as a possible COVID-19 treatment, but even in the US, they revoked its emergency use permit for them, saying they proved to be ineffective in treating COVID-19. And Korea also halted trials of chloroquine last week. Now, the Commission, meanwhile, advised caution in using a drug known as Coletra, which is an HIV medication. It said hospitals should carefully decide whether or not to administer the drug in situations where the use of other drugs is limited.
I see. All right, Aram, thank you for that. We'll see you again tomorrow.
See you tomorrow.
It's time now for the regular government briefing on COVID-19 in Korea. And while we wait for it to commence, here are a few reminders about public safety in light of the recent rise in cases here in this part of the world. Authorities are calling for strict adherence to personal hygiene practices to reduce chances of contagion. Now, these include the wearing of face masks, the proper cleaning of hands, and the frequent ventilation of all rooms. People are also being advised to avoid social gatherings, including religious services, as they can trigger super spreader scenarios. Health officials are also advising the public to minimize the amount of time spent in an indoor public place and to wear a face mask at all times if such a visit is inevitable. Also, for those of you choosing to buy more face masks, the number of government rationed masks that can be bought each week has been raised to 10. Per person, that is, as of last week. The government has also decided to extend its rationing of face masks to the 11th of July. Initially, the rationing was to end late this month. The opening of outdoor swimming pools and public water parks in the Hangang Park has been postponed in light of the sporadic cluster infections here in the country. Officials are now reportedly working to draw up effective guidelines to ensure public safety at these venues. We are still waiting for the briefing to start, and perhaps while we wait, we can take a look at the numbers for this Monday here in Korea. The numbers, as Kwon Soon-man mentioned, we have only 17 new cases today. This is as opposed to the 48 that we saw on Sunday and the 67 that we saw on Saturday. So our total number for this Monday stands at 12,438. We have no change in our death toll, while 4 people have been added to those being quarantined, and 13 have recovered, raising our recovery numbers to 10,881. Now, we have just heard that the official will approach the podium right now to start the briefing. We will come back to you afterwards with our Kwon Soon-man to give you a summary of the key announcements made by the official on this Monday.
First, here is Director Tong Eun-young with the briefing. Let us now begin our regular briefing on the COVID-19 response in South Korea. As of June 22nd, today, we have 11 new local infections and 6 new imported cases, and a total of 17 new cases today, and the total of confirmed cases now stands at 12,438. 13 more people have been fully recovered, and 1,277 people are still in quarantine undergoing treatment, and our death toll remains unchanged at 280. Here are some of the updates on domestic infections. In the Ridgeway of Kwak District, Seoul, we have 4 more cases confirmed, and the total now stands at 198. In Daejeon, at the door-to-door sales business, Seoul District, we have 2 additional cases. In total, we have 49 cases being confirmed. And as for the imported cases, we have 6 today, and 2 from America, 2 from Europe, and also Bangladesh, 2 from Bangladesh as well. And the CDCH, we are witnessing an increase of the cases in the Ridgeway and the MBS Great Nature Korea and Nature Home Doctor, which are all door-to-door sales business firms. And we also ask the public to be have particular precaution. And about 253 people have been confirmed to date as to the door-to-door sales business nationwide, and they have also gathered in clustered environment. They had conversations, and also they had chantings and also eating together, which increased the travel of respiratory droplets. In particular, they held PR sessions and small group meetings, as well as training groups sessions, which have witnessed that the virus has spread among mid to senior aged people. And also, these door-to-door sales business establishments were confined, crowded, and close contact environment. And in order to curb the further the spread of the virus, we have designated these facilities as high-risk facility. And as they have been designated as high-risk facility, we will be mandating all of the visitors, managers, and owners to comply strictly with the quarantine measures. All of the owners and managers need to have the visitor log. They need to wear face masks, and they need to wash their hands and keep their personal hygiene measures. And before and after opening their facilities, they need to disinfect the surfaces on a regular basis. They need to refrain from having gatherings that engage in chanting and eating together. And visitors also need to watch their conditions before they go in these facilities. They need to keep 2-meter distance, and they need to also wear their face masks at all times. And when there are breaches of these quarantine measures, they will be subject to legal consequences, and they will be fined as well. And the CDCH, we are also witnessing that these PR centers for these door-to-door sales business establishments have had concerts that were held free of charge, and they were used as means to attract a high number of elderly citizens to these facilities. So we continue to ask the elderly population to refrain from going to these facilities. Recently, out of all of the people who have been confirmed in relation to the door-to-door sales businesses, 55%, or about 140 of them, were above the age of 60. And therefore, we are also witnessing a surge in the proportion of people in critical conditions as well. And please note that COVID-19 outbreaks can occur in any confined, crowded, and close contact environment. Therefore, gatherings should also be postponed and cancelled or switched to non-face-to-face means. And we also continue to ask the elderly people to avoid visiting these places and comply with personal hygiene measures, including washing of their hands. The KCDC also would like to note that today and tomorrow, the daily temperature, it will rise, and it's expected to rise and peak at about 35 degrees Celsius. And we are also very much concerned about the heat waves here in the nation. And at times of these heat waves, we ask the public to refrain from going outdoors. Please take a good rest at home, and especially starting from noon to about 5 p.m., refrain from going outdoors. And for the people who are working under such heat and hot conditions, we also ask you to take good rest as well. And people who are working at indoor spaces that are high in temperature, including construction sites, greenhouses, and so forth, please consume a large amount of water, and please take a good rest at the shades as well on a regular basis. And in order to prevent COVID-19, it is very important to wear face masks. However, sometimes wearing face masks at a high temperature could also lead to a high burden on the body. So if you are engaging in physical work outside or indoors, if you can have a guarantee of 2 meters of distance with others, we advise you not to wear face masks. And also, in case when you have to wear these face masks indoors as well, please ensure to take a good rest without face masks and keeping distance with other people. And when you use ACs, please also note that the droplets are not traveled in the room, and please ventilate the space every 2 hours, and please have the air to not directly be targeted to the people. And please also adjust the strength of the waves as well. And also please note that the elderly citizens are also very much prone to heat waves and COVID-19, so we ask you to stay at home as much as possible. And globally, we are seeing a continuing COVID-19 outbreak, and after May, we are also seeing a cluster infections here in South Korea as well, which is now spreading from the metropolitan area to Chungcheong province. And it is not yet possible for us to terminate the COVID-19 outbreak at a circumstance when we don't have an effective cure or vaccine against the virus. Our aim is to have good and comply with our social distancing and quarantine measures so that we will be able to manage and control the COVID-19 outbreak under our public health system as well as a medical system until we have an effective cure and vaccine against the virus. Therefore, it is very important to toughen our quarantine measures. However, it is also very much important for us to treat the severe conditions patients at first. So we believe that it is crucial that we have quarantine measures put in place in terms of the individual and community level. And individuals also need to minimize their exposure to the virus. And second, it is very important to have a physical distance of over 2 meters, which is social distancing, and even when we do so, we can curb a widespread cluster infections. And thanks to the public's participation on an individual level and also the social level need to be combined in order for us to effectively overcome the COVID-19 outbreak going forward. So we ask for your continued participation going forward. Thank you very much.
Right, that was Chang Young, the head of KCDC, with Monday's afternoon briefing. So she has mentioned the danger posed by door-to-door services.
Yes, it looks like door-to-door sales businesses appear to be the key word at today's afternoon briefing because door-to-door businesses emerged as a high-risk factor ever since the outbreak in Seoul's Richway company. And in fact, speaking of that case, that now has 198 total cases, and that as 4 additional cases in relation to that outbreak were added in the span of a day. But that's not all. We also have recently more cases emerging in the city of Daejeon, and it looks like 49 cases there are also related to a door-to-door business establishment. So in total, that's 253 cases linked to such services, and this is why Tong mentioned that strict quarantine measures must be abided by at those businesses, and she actually asked to refrain from events like promotional events and seminars or trainings, especially because many middle-aged to elderly people are related to such events. And she also mentioned that there has been a rise in imported cases in the country, as last week 90 cases were imported cases. And at the end, she also mentioned as the summer weather is getting hotter, people should abide by health recommendations such as avoiding the hottest hours at the hottest hours between 12 and 17 o'clock, and that's because people have to wear masks when they're outside. So that was another tip she gave.
Right, so thank you for that. We'll see you again on Tuesday.
Thank you.
Now, adding on to the burden of COVID-19 for South Korea, escalating tensions on the peninsula amid North Korea's acts of hostility. For a broader perspective on regional stability, I have Dr. Tong Zhao, a senior fellow at the Carnegie-Tsinghua Center for Global Policy in China, live on the line. Hello, Dr. Zhao.
Hi, how are you?
Fine, thank you, Doctor. Let's begin with your thoughts on the current state of inter-Korean affairs.
Well, clearly, I think North Korea is putting more pressure on South Korea in its own maximum pressure campaign in the hope that this pressure can drive South Korea further away from the American policy directives. So in the hope that Seoul and Washington may be able to further consider relaxing sanctions on North Korea, etc. So it's North Koreans' effort to deliberately step up the tensions to put more pressure on South Korea and the United States.
Dr. Jia, while Pyongyang appears intent on raising tensions with Seoul, it seems to have a different agenda for Beijing, with whom it seeks to strengthen ties. What are Beijing's anticipations regarding Pyongyang's future diplomatic moves?
Well, I think given the rising U.S.-China strategic competition, some strategists in Beijing may believe that the recent North Korean provocations can benefit Chinese interests, especially if the North Korean activities can help drive a wedge between the U.S. and South Korea alliance. However, it's also possible that if North Korea wants to achieve its goal of putting maximum pressure on South Korea and the United States, we may see a higher level of North Korean provocations in the near-term future, including possible missile flight tests. And if those activities are taken by North Korea, I think that would raise Chinese concern about regional instability. It may also raise Chinese concern that North Korea might use those provocations to further consolidate its status as a de facto nuclear power. So that would increase Chinese interests to contain North Korean provocations.
Right. I see. Meanwhile, right now, what do you believe is Beijing's stance with regard to the recent rise in cross-border animosity, given its diplomatic ties with the two Koreas, of course, and its current standoff with Washington?
I think it's hard to guess the real thinking of Chinese decision makers. But the official statements from Chinese foreign policy spokespeople are basically the same traditional Chinese talking points, calling for all parties to implement the phased approach, parallel commitment and parallel actions on all sides to diffuse tensions. But I think there is a growing realization in some quarters within the Chinese policy community that, well, there is a need for Beijing to coordinate more closely with other regional stakeholders, including South Korea and the United States. In fact, this may be an opportunity for Beijing to work more closely with Washington. That's a clear common interest between the two capitals to deter North Korean provocations and stabilize the region. So that may help stabilize the U.S.-China relationship and save this bilateral relationship from spiraling into a comprehensive competition.
Dr. Zhao, on a different note, Chinese health authorities are working to contain a resurgence of COVID-19, this time in Beijing. Please tell us a bit about the situation there.
Yes, there have been some cluster infections in Beijing, especially over the region of a major market. There have been a few new cases every day. During the weekend, there are about 20 more new cases added each day. But today, the number of new cases has dropped to about 9, below 10. So it looks like the very stringent effort adopted by the government to contain the cluster infection is working. And there is more massive testing of people who are at higher risk of exposure to the virus. So people are getting used to the new normal of occasional infections here and there from time to time.
All right, Dr. Zhao, thank you very much for making the time to join us live from Beijing at this hour.
Thank you for having me.
Right, staying with the pandemic, authorities in Brazil are working around the clock to contain COVID-19 as their total number of infections soar past 1 million. For more on the situation there, I have Kim Mi-jung, a Korean national living in Sao Paulo. Hello, Mi-jung.
Hi, good evening or good morning there.
It's afternoon here right now, Mi-jung. Brazil now stands as the second worst hit country in the world, after the US, that is. How severe is the situation there?
It is very severe. However, to be completely honest, in Sao Paulo, the area that I live in, you cannot really feel the pandemic. You see that people have masks, they're taking precautions, a lot of people not going out, but that is just in the central Sao Paulo where I live in. However, the outskirts is in a very severe situation. So there's a very mixed opinion here the situation is, but it is very severe. But honestly, I personally do not feel it in my neighborhood, and that is a problem here.
I see, which is probably why health authorities in Brazil are reportedly claiming that the numbers are reaching their peak, Mi-jung. Is this view, however, shared by the whole public there?
No, I can say no, because citizens kind of kept on believing and now not believing, and there are many fake newses around here, and therefore there not much trust in these numbers or whatever, and they just the people that want to take care of themselves, they take care of themselves, and they don't, and that's the situation here in Brazil. So honestly, there's a peak, nobody really cares, and this is a situation in Brazil. That's the severity of this problem. Yes, there can be a peak, but nobody really cares. This is how it is in Brazil at this moment.
That is quite sad to hear. Mi-jung, what do you believe is the reason behind that is the alarming spread of the virus in Brazil, and what is the impact of COVID-19 on daily life?
So Brazil is a very complex economic situation. So if you think about Sao Paulo, where a lot of situation is happening, there's a central Sao Paulo. There's a rich, let's say rich people that live here. However, these people that work here, they live in the periphery. And in the periphery, the quarantine didn't happen exactly as it wanted to. And even now, they just are going out, they don't know, or they are not taking precautions. And therefore, they get transmitted there. And then all these people that live here come to the central, where the most economy is in, and they spread and also contact the virus, and then they go out. And in the meantime, they take the metro, they take the bus, and then it just continues. And there's a constant cycle, and therefore it just continues to go on. And then Brazil is such a complex economy. So for them, it's either I die of hunger or I will get coronavirus and I die. So then they will just go out and continue working. It's a very sad situation, but this is a reality here in Brazil.
Mi-jung, speaking within your capacity as an ordinary citizen, of course, how do you assess the state of the country's economy right now?
This economy has been very bad since 5-6 years ago, and it's going worse and worse. The dollar and the currency is bad, and it's just going down worse and worse. And actually, I'm really sad to say this, but it's just going to get worse. And sadly, Brazilians are quite used to this. They're very used to the economy being bad and being and surviving off of these pandemics or these bad situations. So that's how it's going to happen, as I see.
All right, Mi-jung, thank you for being with us today to share your thoughts, and do take care.
Thank you very much. You too.
코로나19에 대한 종국적인 해결책이 결국 치료제와 백신이라고 얘기를 합니다만 우리의 의식, 일상 그리고 전반적인 사회 체계도 진화되고 적응이 되어야 최종적으로 코로나19가 종식될 수 있다고 생각합니다.
We must also remember that although the situation is improving here in Europe, globally it's getting worse.
In today's studio discussion, we take a look at the latest developments in Korea with regard to COVID-19 as some of its global counterparts, including New Zealand and Slovenia, retract words of being virus-free following a few new cases. I have with me here in the studio Professor Kwon Soon-man from Seoul National University. Welcome to the program, Professor Kwon. And I also have Dr. David Kwak from Soonchunhyang University Hospital. Hello, Dr. Kwak.
Good afternoon.
Professor Kwon, we'll start with you. Korea is tackling a series of sporadic cluster infections as well as a rise in imported cases. What are your thoughts on the situation faced by Korea at the moment?
Well, I think it's time to increase our vigilance and exercise more caution. Although I can't say it is a critical moment, but we need to be more careful for several reasons. First of all, as you know, there are an increasing number of new cases, but more importantly, what is the nature of these new cases? In that sense, the infection is spreading outside of Seoul Gyeonggi area, further to south, and there is an increasing number of new cases from abroad. And also for me, most serious issue is that the composition of the new cases. In other words, there are not, increasing proportion of the older population who are the most vulnerable cases. So that means a more severe cases are increasing. So I think it's time to take more caution at this moment.
And despite our reality, Dr. Kwak, as I mentioned earlier, there are a few countries that appear to be keeping the virus at bay quite effectively. Could you tell us a bit more about these countries?
Sure. So we've seen a few countries that claimed themselves to be COVID-free for the time being. And as you mentioned, 2 of the countries already retracted their statement, which were, I believe, New Zealand and Slovenia. They're still running very low in their numbers, new cases, and they've only had, to my knowledge, 1,000 or so cases in total. But other countries, including that of Taiwan and also from Laos, they are also running low. These countries, at least 3 out of the 4, were running a very tight program to contain the virus and mitigate the virus, and that worked very successfully for them. And they achieved that spectacular number of 0 at a certain point of time, but then more so the numbers are fluctuating. And for the cases for Slovenia, they just managed it well. So I applaud them for their effort and their achievement. One thing to think about among this situation, though, is that if they worked so well to contain the virus, they still should plan ahead for what's to come in the future. They cannot close the border forever. Something has to be done to manage the breach of the virus into the country in near future. So I believe those are the things that they're going to have to start worrying about.
So they still have work ahead of them?
I would think so.
Professor Kwon, in your view, when can a country effectively declare itself free of COVID-19?
Well, this COVID-19 is a new disease. So there is no consensus about when and how to declare it's over. I think that's my honest view. So in a sense, currently there's no scientific basis how to define the end of the system. So I think our goal is not to end this something like war against COVID-19, but rather how to manage this current crisis. So what is the definition of effective management? That should be defined in the context of the capacity of a healthcare system. In other words, if you can keep the number of new cases, but more importantly, if you keep the number of cases who need hospital care, if you keep that level at a certain level that our current hospital system, current healthcare system can cope with, then it's okay. But if the number of cases are above that threshold, then it's a problem. So rather than aiming to declare the end of this war, but we should have more realistic target and policy goal to keep the whole crisis at the level that our system, our policy level or our healthcare system can handle.
Mm-hmm. And perhaps such words by Professor Kwon come amid, Dr. Kwak, a study in China that claims the virus itself, the COVID-19 virus, is prone to mutations. Now, if this is the case, then surely declaring an end to the pandemic would be virtually impossible in the absence of a vaccine or a drug.
Well, that can be said, but also we should focus more on not so much of the mutations, but rather how we're going to manage the virus. Of course, some of the studies are claiming that there are mutations that are found. Actually, that study claimed that the mutations work towards better clinging of the virus towards human cell, meaning more infectivity of the virus. More easily, they could infect other people. If that is the case, it still doesn't mean that there cannot be a vaccination. There cannot be a treatment of some sort. We could still come up with some sort of treatment regimen or some sort of vaccination that could hopefully eradicate the virus complete once and for all. But that's a dream that we should have a goal, but not realistically speaking. So what I would like to emphasize here is that even though there might or might not be mutations, that's not something that we need to be completely focused on, but rather we should come up with, well, not just the vaccination or treatment regimens, but also, as Professor Kwon said, how we're going to manage ourselves to prevent ourselves from getting the infections.
Professor Kwon, what are your thoughts on the view that it is too early for any country to declare itself COVID-19 free, as many are looking to a second wave of infections?
I agree that it's too early to say that it's over, mainly because, as we all agree, the unique nature of this global pandemic is that there's no border. So this virus can easily cross the borders. So that means probably we can safely say it's over when all countries in the world stabilize the situation. Before that, we cannot say it's over. But I can understand that many countries, probably Korea as well, may have some temptation to say it's over because many countries are struggling with the impact of this COVID-19 on the social and economic activities. So people urgently need to get back to normal social and economic activities in life. So that's why the government have some kind of political pressure, in a sense, to say it's over. That means, okay, it's time to get back to normal life. But as we know, there may never be the same normal now, because even if we can stabilize the situation, maybe we should be prepared to cope with it, deal with a new normal, not the same normal as before.
Right.
Yeah.
Dr. Kwak, you can call me patriotic or ignorant, but given the praise that Korea had garnered in the initial stages of its response to COVID-19, I had expected Korea would be one of the first to declare itself not COVID-19 free, but perhaps to have kept the virus effectively at bay. What is making it so hard for this country to keep the virus at bay?
I wouldn't call it, it is being hard. As we lowered the level of social distancing to daily life distancing, we expected the number to rise. We are still managing. Hopefully, we would be able to manage, as KCDC claimed that if we contain the numbers to be lower than 50 and the proportion of the new cases to be lower than 10% for those who are non-traceable for the infection, then they're going to keep the level as it is. So we are going through that phase. But also some of the facts actually work into this matter, such as our mindset. People, as Professor Kwon said, we are very eager to go back to our normal life, but we have to define our new normal life for ourselves because we just don't know when the pandemic, or if ever, will actually leave us. So we have to keep to ourselves a new mindset that this new sanitization level, we're going to keep possibly for the rest of our lives. But it is also working in a better ways for other diseases as well. I probably talked about this before to my friends, but not just for the COVID-19, but these harsh sanitizing measures that we keep for ourselves are working very well for other infective diseases as well. So why not keep these? That's what I'm going to say for now.
And speaking about the sanitation measures, before we proceed, Professor Kwon, I understand you have a list of these words of advice for public to keep their health amid the pandemic. Could you tell us a bit about that list that you've made?
Well, most importantly, personal hygiene and social distancing. Basically adhere to or comply with the governmental recommendations. But as a human being, from a behavioral science perspective, although many people understand that we should follow these guidelines, but it's not that easy. So that is one of the reasons why we are still struggling with this, and not just Korea, but that's one of the key reasons why most countries in the world are struggling with, because we know wearing a face mask is very important. We know we should cancel the meetings, but in reality, it's very hard to keep the personal hygiene. So if you have an angle of behavioral perspective, to some extent, I can understand, although I keep talking to my friends, to my son, that this is the something that we should follow and adhere to.
Right, that is difficult. Dr. Kwak, what more can Korea do to strengthen its quarantine efforts?
I'm going to say that we should urge ourselves to keep all these measures, but that is including keeping the mask on when we're going outside. It's just not containment to when we're actually walking outside or meeting other people, but everywhere I go, once we step outside of the house, we should start wearing a mask. We already know that there has been a study that said if only one person was to wear a mask while two people were meeting, that still decreases the level of infection from one to another by a significant amount. But if two were to wear the mask at the same time, it decreases completely. So that's something to keep in mind, but also to keep other measures such as washing our hands for 30 seconds, also ventilating our spaces by opening up a window and possibly, and also avoiding sharing food with others. Because in our culture, when we dine outside, we always share with each other our foods and we always talk very loudly to each other. That's something probably that we can avoid for the time being.
Right, those are some great words for the public to keep in mind, I'm sure. All right, Dr. Kwak, as always, thank you for your thoughts. And Professor Kwon, thank you for your thoughts today as well.
Thank you.
Well, that brings us to the end of Monday's edition. Do join us again tomorrow as we touch upon regional security and diplomacy amid the pandemic in light of North Korea's hostility. In the meantime, we welcome your thoughts and inquiries through our social media accounts or our homepage, arirang.com. Do take care and see you tomorrow.